Let's discuss about an autoimmune disease, Kawasaki disease. This Kawasaki disease is a condition where the autoantibodies seen are the anti-endothelial antibodies are seen. This condition is more commonly occurs in case of children. In 80% of the patients are the children, and it occurs more commonly in boys than that of girls. And in this condition, we find unremitting fever will be presented by the child for greater than 5 days. So whenever the child complains of greater than 5 days of fever, unremitting fever, then we need to think about the condition Kawasaki disease. And it is the most common cause for vasculitis in children. And as I already said, anti-endothelial antibodies are seen in this condition. And let's look into the clinical features and also the investigations which help in the diagnosis. This is the most common vasculitis condition in children. This vasculitis is seen only in children, and the incidence is 80% in children, that to age less than 5 years of age. And this condition is more common in case of boys than that of girls. And the clinical feature which is most important is the unremitting fever lasting for greater than 5 days in a child. And here the autoantibodies which are implicated are the anti-endothelial antibodies are present. And we need to keep it in mind that this fever is often associated with, conjunctival congestion, rash, anterior cervical lymph node enlargement, swelling of hands and feet, red swollen cracked lips, along with strawberry tongue, along with erythematous oropharyngeal mucosa. And these are the classic features which are associated with the fever in these patients. And investigations, there is no lab guidelines for the diagnosis of Kawasaki disease, and this condition is entirely a purely clinical diagnosis. And the most common cardiac complications seen in the patients of Kawasaki disease are the myocarditis. And if it is a dangerous form, if the children develops coronary vasculitis, it is a most dangerous form of Kawasaki disease. And let's see the treatment plan that is given to these children. IV immunoglobulins and aspirin is found to be the mainstay of treatment in the patients of Kawasaki disease. This is in brief about the autoimmune disease Kawasaki disease, which is more commonly seen in case of children. And thank you for watching.